Okay, thank you, colleagues, for your patience. I really appreciate it, and I'm going to get straight into it. And please feel free to put your comments and questions in the chat, and Lauren will alert me to that. And I will just focus on the major or the most important part of the study. So once again, welcome. So I started entitled Developing an Online Generic Mathematics Diagnostic Tool, Leveling the Playing Field. So in terms of the background and the rationale, and I'm not going to dwell too much on it, so but basically the motivation for the studies is to address the disjuncture between high school and university mathematics, especially within the COVID-19 context, and also the need for diagnostic support and remedial support, which is have to be in addition to the bridging and the foundation courses which exist at the university. The significance of the study is basically, like I mentioned earlier, to profile students in terms of their mathematical strengths and to identify the mathematical and content knowledge gaps that do exist, and also to help lecturers with their lesson plans and curriculum development. The study focused on 3 research questions. Firstly, it explored the content gap that exists between high school and university mathematics. Secondly, we also looked at investigated the perception of mathematics lecturers in terms of diagnostic tools, and then lastly, we calculated an absolute cut scores for the diagnostic tool. In terms of literature review, which basically we mainly focus on literature on standard setting and the procedure in terms of how to follow the procedure to standardize a specific test, and also we pointed out the importance of standard setting within the test cycle, and you'll see that it is right at the center of the test cycles, and it's a very important component which is mostly neglected. And in the standard setting process, we basically identify the performance criteria or the performance levels of students. We either pass or fail, basic or proficient candidates or exceptional candidates. And then there are also different models that can be used to do standardization. But specifically for this research, what we used is the modified Angov method. And the motivation for that is because the ease of use and also the ease of administration and convenience for multiple choice test, and also its popularity, and most importantly, it is considered defensible in courts as well. And in terms of the research method, this is an exploratory research design, so which is located within the interpretive research paradigm. And the sample consists out of 5 mathematics lecturers, 11 mathematics consultants, and 5 high school mathematics teachers. And the method that we follow, we break this study up into 5 phases, of which we completed 3 phases. The first 2 focused on, we used focus groups, and the last phase were a workshop that we did with the mathematics content experts, where we calculated the cut scores. Phase 4 and 5, 4, which is the institutional pilot of students, it still has to be done. And also we plan to digitize this tool to make it an adaptive, and also to bring in the gamification features to combine the diagnostic assessment and remedial interventions. Permission were granted by the university's Research Ethical Committee. Findings. So the findings were based on the 3 research questions. The first one the mathematical content gap. So it was found that the National Senior Certificate and the National Benchmark Test did not cover some of the major pre-calculus topics which is needed for university mathematics. Among them is complex numbers, vector analysis, and integration. It's also found that about 50% of the students who got distinctions in matric, they are failing the first year mathematics, and then 20% of the matrics achieve pass. That is allowed access. Only 20% is who pass are allowed access at the universities. And then very alarming is the fact that only 8% of candidates who achieve more than 60% in the matric exam in 2018, which is the requirement for study engineering programs at universities. In terms of the perception of the lecturers, it was found that most of the responses were positive, except for question 5, where they had to respond to the question whether diagnostic tools, whether they're using diagnostic tools effectively in the teaching, and most of them indicated that they do not. They actually neglect diagnostic assessment in their teaching and teaching practices. Okay, and these were basically the overall perceptions of the lecturers, and I'll focus on the last point there. Teachers felt the diagnostic test helped them modify their teaching and also reduce the likelihood of perpetuating misconceptions in the teaching. And now we get to the diagnostic tool itself. The diagnostic tool basically consists out of 5 levels, which are covering the five different disciplines of mathematics: algebra, trigonometry, geometry, finance, and pre-calculus. Unfortunately, I would have loved to share the instrument with you guys, but I don't think time will allow me to do that. But you are able to do that in your own time and space. And then the cut scores. How was that established? Very important in determining the cut scores is the borderline candidate. And the borderline candidate indicates the different proficiency levels or the different performance levels. And we use the last one. In this particular instrument, we found, or we calculated the cut scores for a basic student, an intermediate student, and a student who are proficient. And so to illustrate it more, if we have a group of students, then we have the 3 different performance levels: basic, intermediate, and proficient. And your borderline candidate would be the student who just get into the next level. And
so
then,
Dr. George,
yes,
just to bring to your attention that there is 3 minutes left for the entire presentation.
Thank you very much. So I can take it a little bit slower. Right. So the diagnostic tool and the cut scores. Yeah, when we developed it, we had the panelists, which were our mathematic content experts, which were our sample, and they had to familiarize themselves with the purpose of the test firstly, and then they also have to identify the ability, skills, and knowledge. Those are the performance areas, descriptions. For example, for basic level description, the candidate needs to perform routine computations, simple algebraic manipulations, and also express relationships among unknown quantities and recognize and use familiar formulae. So this was the first description which they have to familiarize and have to identify. And then each panelist also score the 40 items. So the instrument consists out of 40 multiple choice questions. and they have to score each item in terms of their perception of what a borderline candidate would respond to a specific item. And the scores were then combined in a score sheet to get the overall test score, and then the final rating of the MCEs were then averaged to determine a consensus opinion, right? And then the formula that's on the screen, that formula has been used to calculate that consensus cut score for each item. And then finally, in terms of the cut scores, to account for errors that might have crept into the process, the cut scores were slightly adjusted downwards. And then the cut scores for each of the items were summed and rounded to develop the cut score for a given performance category. And on the table, we have the cut scores which has been calculated for this particular diagnostic tool. And you'll see you have the average cut scores, which has been adjusted downwards a little bit to get the cut scores, the final cut scores, which is then also rounded into whole numbers. And of course, these scores are all out of 40. So we see for if a student got below 10 out of 40, that student would be considered as below basic. 25 out of 40 would be a basic student, and a proficient student would be a student who got 30 out of 40. So that would be the ideal student that a first year lecturer would have loved to have in his mathematics course. In conclusion,
Dr. George,
yes?
I'm sorry, I have to tell you it's 10 seconds for the conclusion. I am eating into the next presentation now.
Okay.
Thank you. Wrap it up, please, Doctor.
No, it's fine. So basically, in conclusion, and I think the most important point here is the last one. We recommend that diagnostic tool development should be part of all lecturers' performance, professional learning, and development. And that brings me to the close. And Lauren, like you said, it's very unfortunate that we don't have an opportunity to ask questions, but please feel free to share your questions or comments in the chat. Thank you, Lorraine.